Is prevention better than fixing what's broken? I'm Dr. Angela Sturm. I'm a facial plastic surgeon, and lots of people in their 20s and even younger a little bit sometimes, people will ask, should I start skincare now? Because as we know, skincare in the teens and preteens is a huge thing right now. So start skincare, and then in your 20s, should I start Botox? And then when should I start fillers? And to a certain degree, prevention is better than fixing it later. But there is too early. I think skincare is great, and I think that's one of the things that people should start early, and they should start taking care of themselves. But whenever you're a teen, preteen, it should be really, really simple. You do not need a retinol. You don't need growth factors. You don't need any of those things. Your skin is amazing as it is. Enjoy being the age that you are. Wear sunscreen. The teens, preteens are way better about the sunscreen than we were whenever I was their age, because we just didn't know. Definitely the sunscreen, a good moisturizer, and a good face wash. That's amazing. That's going to do a lot for you. And just having a regular routine really does make a difference in your skin. When you get into your 20s, maybe Botox is something you can do. Maybe you don't need to yet. I really feel that the perfect point to start doing Botox and that sort of thing is when you start to see a little line, and whenever you stop moving, that line is faintly still there. Before they stay, are you preventing? Maybe, maybe not. I know people in their 70s that whenever they move their forehead, the lines just don't stay. That's just not how their skin and their muscles work. And so if they were preventing all this time, we wouldn't know, but really that person didn't necessarily need to prevent those particular lines. But whenever you do that movement, you raise your eyebrows, you smile, and the line stays ever so faintly to the point where you're like, oh, I can see it, but your friend is like, I kind of think, yeah, I don't think so. I don't see it. That's the point of, okay, this is going to stay whenever I'm not making those facial expressions. So that's a great time to start Botox. Is that in your 20s? Is that in your 30s? It kind of depends on you and your skin and your sun exposure. And the better you are with those things earlier, the later that can be for you. Save you the money, save you the time, all that good stuff. I don't necessarily feel like fillers are preventative. I think that that is something that is treating a low spot, a line, augmenting some volume. So I don't believe in preventative fillers, but I think you can do things for your skin that are amazing. You can start to do some very light lasers when you're in your probably 30s. Maybe you're starting to see a little bit of pigmentation here and there. That's when a lot of people will start to see things like melasma come, that you can treat that and stay on top of it, because that's a condition that stays with you for your whole life and you need to treat throughout your life. But lasers are a great way to prevent some of the things like the fine lines, to stay on top of pigmentation, and start with things that are just really easy, very low downtime, they're very low risk, because you don't want to take on more risk for your skin than you need to at that point in your life. Yeah, you could go get a CO2 when you're 25, but you have the risk of poor healing and potential hypopigmentation and all of those things that you don't really need at that point. When you're later in life and you have lines that stay and you have things that you can treat and you have brown spots, that risk-benefit profile is better, and that's more. I love the CO2, and for that person, that's going to be a great option. If you don't really have those things yet, it's not really worth that at that point. There's not really like a preventative surgery. I see people talking about earlier facelifts. I wouldn't say that's a preventative thing. I would say that's something that if that's what you want to do, you can get a lot out of surgery in a time point. So same idea, where you can see the laxity, the jowl is there, the skin is there, but is it too bad at this point? Not too bad. Maybe you want to do surgery a little sooner than later and just enjoy it longer. For me, that earlier is in the 40s. No, it's not in the 20s, it's not in the 30s. You look great at that point. You're probably a little too early, and you may not get as much benefit out of it. And it's hard to say, oh yeah, I'm so excited that I did this, if you didn't really have that jowl to start with, because what we're aiming for and that bullseye is so close to where you are. It's really, really hard to have a home run. But if we have something and say, yeah, there's some skin there, there's some jowls there, and then when we lift it and you say, yeah, that's not there anymore, it's much easier to say, yeah, I'm really happy with the fact that I did this. I'm glad I spent that money. I'm glad I spent that downtime. The risk benefit of this has been really in my favor, and I'm so glad that I did it. So that's, Like I said, 40s is the earlier time point. 50s is the sweet spot. That's when nobody's going to notice it, but you have enough aging that, yeah, it's going to be really, really exciting and really good. So there are things that you can do preventatively. I see a lot of young people doing things like fat transfer. It is longer lasting than fillers. It is something that, there are growth factors in it. It does help your skin. I still feel like volume replacement should be more of a treatment than a prevention, because you do have that potential of weight fluctuations and changing of your face over time. And so it's not necessarily something that I like to do in younger people unless there's something specifically that we're treating, of like a asymmetry or significant volume depletion without the laxity. Whenever you go through childbirth or you go through hormone fluctuations, there may be changes in your facial fat and the body fat that can give you a different appearance. Or especially if you go through menopause and your body changes and the fat that you took from your belly or your thighs is going to act like that fat from the belly and the thighs. And if it gets larger than what you had intended, then maybe you look more full and not exactly the outcome that you're coming for. So some things that I see people doing preventatively, maybe I think of them more in a treatment fashion. So taking care of yourself is number one, eating well, hydrating, sunscreen, a simple skincare routine, something that's not too harsh, especially when you're younger. Keep and celebrate the nice skin that you have whenever you're younger, and then be able to evaluate things as you go and things that you can do. Oh, if you have other questions about prejuvenation or things that you can do earlier in life, let me know. I'm Dr. Angela Sturm. You can find me at Beauty Unveiled, where you get your podcast, and www.drangelasturm.com.